It just kind of feels like your feet are getting ran over all day long. Like if someone accidentally reversed onto your foot, that's what it feels like all day. And it gets really inflamed, and it's a throbbing, nagging pain that just lingers all day. After my days of dancing from 8 to 4:30, it took a toll on my body and my feet that I just couldn't bear anymore. And so I said to my parents, I need to find a doctor and I need to do something about it. It's been too long for me to be dancing like this that I have to do something about it.
With Paxton, I realized it was a huge part of her life. This is what Paxton does. She dances. Period, plain and simple. Her major is dance. She's getting a degree in dance. I know athletes and I know dancers, and less is always more. She actually came in with bunions and a tailor's bunion and hyperpronation, that kind of flat feet. I could have gone in and corrected her bunions and corrected her tailor's bunion and done a flat foot reconstruction, but she was young and she was a dancer. And I knew that doing a major procedure like that on her would have taken her away from dance for a long period of time, if not indefinitely. And this was a perfect option for someone like her. She needed to get back to her dancing as quickly as possible, but functional.
It's given me more confidence to just go for it, to just know that my body's taken care of and that these little wedges aren't going anywhere, that they're there to help my feet.
Well, HyProCure is very unique. It's probably one of the most unique procedures I do because it can change the entire position of the foot, essentially the rear foot or the subtalar joint, without having to disrupt a joint, without having to remove any cartilage, without having to remove any bone or cut bone. And it's a very small implant that goes into the foot, such as an orthotic can correct the position of your foot. This implant can correct the position of your foot. So it's like taking a little tiny orthotic and putting it right inside your foot, and it's so minimally invasive. The risk of complications with a big procedure to correct something like she has versus the risk of this little tiny implant that doesn't destroy a joint, doesn't cut a bone, doesn't require a lengthy period of time off your feet. It's amazing. That's what makes HyProCure so unique. HyProCure is a fabulous answer to a flat-footed child who's having pain or discomfort, a flat-footed young person who's having pain and discomfort. The HyProCure is the most gratifying procedure I do because people do so darn well with it. And seeing Paxton, I mean, she tells me she's doing really good, but to hear her say, wow, I would like, you know, have to wrap my feet at night and I'd wake up in excruciating pain, and now I don't, and I'm dancing, and that elates me. I'm so happy she's doing so well. I'm just ecstatic she's doing so well.
The old Paxton was very weak in my feet and very timid about what I would do because I was scared to further my pain. And the new Paxton has confidence that I'm not going to feel that anymore and that I am going to rock my performance. It's going to be great.